please look at my cecum. Now, maybe the locale wouldn't be there, but the family history's there. Anything found before, I just got colonoscopies. Now I wanted somebody who was really going to look. And he found 6 polyps, and he found 2 of them in the cecum, and they were all adenomas, so precancerous. So hopefully, he got them, he snipped those. He says, I'm going to get another one in a year. But that's how I chose. But that data was available. People are going to choose you based on how well you do. Look at health grades. Go on there, just not for hospitals. Look at it for physicians. It's coming. It's coming, ladies and gentlemen. All right? Maybe thinking about just a couple other things here. Something I used to always talk about, and some of you remember me talking about this, the drug doctor. I'm not talking about drugged up doctors. I'm talking about your power as a physician. The drug physician. Dr. McFadden was reminding me of that, is don't doubt your power. We've got to have knowledge. And, it's not, like I said, facts tell, stories sell. But your power is through your relationships, through your understanding of patients, through you can care and concern about people. And I think that comes through. It comes through. They don't care how much you know till they know how much you care. Sir William Osler, I said that the last time I was there. Just so powerful, so powerful. So think about that. Think about, you as therapy. You are powerful. I think what you did tonight, you guys, as the leaders here, you're powerful because of your personalities. Your knowledge is important. You taught me a hell of a lot today. I don't know what I'm going to do with that knowledge. Except make sure I get myself injected, all right? Because I haven't had it. I'm going to get that. So you did help me out as a patient caregiver, but I don't take care of, I don't do that anymore except relative to diabetes. But it's our knowledge is important. But our patients just expect that. Yeah, you know something. You've got an MD or DO degree. We know you know something. And I think Sharon was mentioning that today, holistic. Well, don't forget your power. Don't forget your power. Another thing I was reminded of, Dr. McFadden was telling me, he says, I remember as a resident, once you talked to a family, do a little bit of marital counseling, didn't seem to do the damn thing. But they came back in 2 weeks and they were better. So what I do, I listened. I mean, that's our power. We listen. Because a lot of times that's the best. That is the best medicine there is. So don't doubt your power. And in everything we do, unfortunately, we've been bullied into volume-based care. We don't get paid. But I tell you what, if you start thinking about how you can do the things that really need your degree, get your staff doing more, the time you do spend in there will be effective. But I think the medical home is going to change that thing because it's going to be quality-based. You're going to have, your name's going to be in health grades. It doesn't even need to be in health grades. You need to know that. You need to know that now. I don't think you're being honest with yourself. If you don't know how you're doing for diabetes, hypertension, for COPD, how many of your patients are you really doing what the standard of care would be? And now don't tell me you're doing it because I've been to 95 doctors' offices in Florida and Georgia and other states in this country, and everybody tells me how good they are. I think what you're good at is remembering your last patient. Because how about the ones that haven't been in to see you? You're still responsible for them. How many people did you order mammograms on that never got it? And do you follow that? I mean, that's what the medical home says we've got to do. Those are quality issues. Now, I know you might say, well, I can't do all that, I don't have the time, but you start getting reimbursed for it. There are models where you're getting $85 to $100 more per patient per month because they know what happens if you do that. What happens? You save money. If you do it for diabetics, what happens? You save their eyes, their kidneys, their MRIs, their strokes. They don't get to see the cardiologist. They don't go up to the ICU. Now, they may eventually at age 90 get there, but it's not the 50-year-old. Think of the productivity we lose. So think of what you can do with that. And I know you got lots going on. Maybe a couple closing thoughts here. Just Covey's book, 7 Habits of Effective People, I love one thing, and you probably read it. A man, you know, busy sawing down a tree. I'm sure you read this. And he tells you he's been sawing away for 5 hours, and you notice the blade's very dull. And you say to him, I wonder if it would be good to sharpen the saw. He says, I can't, I'm too busy sawing. I think that's what we say. I think Covey's point, that we are too busy. And sometimes, are we really doing what we want to do? I wrote a book on retirement recently, and had 800 AAFP members send me their surveys why they retire, and how many of them because of burnout, because of anger, and doing interviews with them. You know, that I think we've got a lot of burned out people out there. It's hard to keep your enthusiasm. I admire the people who won the Preceptor, you know, of the Year award, and your commitment to volunteerism, and I admire you so much. But it's hard to keep that up. It's hard to keep it up. But you know what? We appreciate it. We appreciate it. We appreciate everything that every one of you does. And I'm telling you that not as someone that directly benefits, but I benefited tonight by hearing you're doing it. It just feels so good to hear what they're doing. It feels so good to see you guys prospering, doing well, wanting to do better, going internationally, helping other people. I think that's what it's all about. So I hope I've provided you with a few thoughts that you can use maybe for solutions. And remember who's going to be the primary beneficiary of our solutions. You know, our patients. Our patients are our past, they're our present, and they're our future. If we empower them, we empower ourselves. Thank you very much.
Well, thanks, Ed. Now, as we said, now we know why this was one of the birthplaces for family medicine education, because we had Ed Shahady. Last item of the night, I'd like to have all 5 of our presenters come up. I think Dave is already covering the Talmadge game. Hopefully it's a boring one for him from a physician standpoint, but if everyone else could come up with Ed. Ed, why don't you come over here? First of all, one last presentation to Ed. What do you get the man who has everything, an active Congress? What do you get someone who has an active Congress? How about 3 more? And this is thanks to the efforts of our foundation, the power of advocacy. There are also proclamations for Ed that are coming from Congressman LaTourette. But it's late. He must have known you're a Democrat.
Is he a Republican?
Yeah.
Oh my goodness.
No, it's somewhere in the mail, I'm told. That's right. And he has the one from Congressman Ryan. There's one here from Congresswoman Betty Sutton that I'll read just a couple paragraphs out of, and also one from Senator Sherrod Brown. So, Ed, congratulations.
Thank you.
And just to read some of the proclamation from Congresswoman Sutton. Over the past 40 years, Summa Healthcare's Family Medicine Program has produced over 200 graduates that can be found all over the world. Summa maintains a quality tradition in medical education, including the hands-on experience resident receives with patients' interaction, as well as working with residents of other disciplines. Summa's Family Medicine Program's excellence is associated with the individuals who have been and currently are involved with the institution. Dr. Edward Shahady is one of the original founders of family medicine and helped establish one of the first departments in the country at Summa. Dr. Shahady has made his presence felt through various training programs, nationally as well as countries around the world. I, Betty Sutton, representative to the United States Congress from the 13th District of Ohio, do hereby recognize Summa Health System Family Medicine 40th anniversary and Dr. Shahady for his numerous contributions to the community. And each of our presenters is going to get, we won't take the time to unpack them all here, but another small memento of today's program. This is Dave's, he's not here, but just read simply, Summa Health System, Akron City Hospital Family Medicine Residency, 40th anniversary. And there's a quote that's not mine. I stole this one off back in the day when all the teaching awards used to hang here in the basement of the 75 building. There was a Dr. Failer Surgical Teaching Award, and you remember Dr. Failer. And it has a simple quote that we put on here that Matt, I think, was fitting for all of our 5 directors. A teacher's legacy is the future. So each of them will get one of these to take home as a memory from today. And we hope you'll go away with some good memories from today. Please remember that you're all the family in Summa Family Medicine. Keep in touch. Hopefully it'll be easier once Izzy builds our database. And thanks for coming. We hope a lot of you can come to the social hour. Thanks again and good night.